Okay, this is a really common question. Why are my teeth all of a sudden shifting? My teeth used to be perfectly straight, but now my teeth have started drifting a little bit, or my lower front teeth have started crowding a lot. Your teeth don't just magically shift for no reason. There has to be some sort of pressure or something applied to that tooth in order for it to move its position. So today I'm going to go over 8 reasons why your teeth might be all of a sudden shifting. Number 1 is natural shifting as you age. So as you get older, your teeth tend to narrow and kind of close in. And this in turn will lead to crowding, because as your teeth start to drift in, there gets less and less space for your teeth to all be aligned in a straight position. So what happens is your teeth have to start getting crowded. And this mostly happens in your lower front teeth. Because you can imagine if 2 teeth are right next to each other like this, and then all of a sudden they start to drift in a little bit, one's gonna get a little crooked. Now, what causes this shifting as you age? Well, it's because of all the musculature that's in your face. So you have your lips and your tongue that's constantly moving and putting pressure on your teeth. And this is why those lower front 4 teeth are so easy to move as you get older. 1, because they're the smallest tooth, and 2, because you have so much musculature around them. Now, how can you prevent this shifting? Well, the simplest way would be getting a retainer made. So if you never had any braces or orthodontics, that probably means that you never had a retainer made for you. Well, you can simply go to your dentist and ask them to make you a retainer that you would just have to wear at nighttime, so that whenever you go to sleep, you pop in this retainer and that will hold your teeth in the right position. Now, the thing is that there is nothing really natural about this. I call it this natural shifting as you age because it happens to nearly everybody, but it really shouldn't be happening if we had proper oral posture. And this actually leads us to number 2. The second reason that your teeth are shifting is because of bad oral habits. So these are things like thumb sucking or tongue thrusting, where you kind of stick your tongue out, or mouth breathing. If you don't breathe through your nose and your mouth is always open, then this can also lead to some deformities in your teeth. Now, if you have bad oral habits, this is probably why your teeth are not in the right place in the first place. So the rates of tooth crowding have been going up. And the reason is that our jaws have been getting smaller. And when that happens, that means that there's less room for our teeth to come in the right place. And this is also why our wisdom tooth might not come in the right place, and why we might need to get our wisdom teeth extracted. The biggest things that cause our jaws to not develop and grow in the right position is because of problems when our jaws are still developing. So if we're not chewing our food enough, if we don't have proper oral posture, and if our mouth is always open, like if we are a mouth breather, then these are all going to lead to deformities in our jaw, which will end up leading to deformities in how our teeth erupt. So if you look at any fossil records from before industrialization, you'll see that our ancestors had these really wide, spacious jaws where all of our teeth came in the right position. But now, if we see jaws, we'll see that hardly anyone has a jaw like that that's so spacious. And the reason is, after industrialization, our food became a lot more refined and our food became a lot softer. And we had to chew our food a whole lot less. And when we don't chew our food as much, and instead as we're growing up, we have these mushy foods, then those stem cells in our jaws do not get stimulated, and then our jaws just don't grow as wide and forward as they're supposed to. And also, if we don't have good oral posture, it won't reinforce these stem cells to keep growing in the right position. So an ideal oral posture would be our tongue resting against the roof of our mouth, and not just the tip of our tongue, also the middle and the back part of our tongue. And also, our teeth should be slightly touching and our lips should be closed. That tongue being against the roof of our mouth will also stimulate that palate to grow in the shape of our tongue. So it'll grow in this U shape, which is wider and forward. Instead, if our tongue is against the floor of our mouth and our mouth is always hanging open, and also if we're a mouth breather, which will also encourage this mouth open posture, then our jaws will stay narrow and our face will grow more elongated. So if you keep up with these bad oral habits as you're getting older, then our cheeks will keep everything constricted, and then our teeth will end up being crooked. Now, this is all as your teeth were developing, but let's say you went through braces and then you got your teeth straightened and everything is good again. Well, if you keep up with these bad oral habits and if you don't wear your retainer, then those bad oral habits are going to shift your teeth again. Like if your mouth is always open and those cheeks are always constricting your teeth, then they're going to cause your teeth to start getting narrower and narrower. Or if you're still sucking on your thumb every day as you get older, then that pressure from your thumb on your teeth is going to keep pushing those teeth forward and out. And that's how you can get that open bite, where your front, top, and bottom teeth don't overlap at all. Because you don't need a ton of force to move teeth. Like if I push on my tooth really hard for a few seconds, then that tooth's not going to move. What you actually need is light pressure for a longer period of time. And this is exactly how braces or Invisalign work. They put that light tension on your teeth. Instead, if I keep pushing on my tooth really lightly for like 12 hours, eventually that tooth will start to move. Now, obviously you can't do that, but your braces or Invisalign can do that because they are putting that pressure on your teeth for that long and longer. Now, number 3 and the third reason that your teeth are suddenly shifting is because of gum disease. Now, gum disease has different phases, and I actually talked about more into detail about the different stages of gum disease. So I'm putting that link in the description below if you want to learn more about that. But when gum disease just starts off, it's called gingivitis, and this is the most mild form of gum disease. And this only affects your gums. And this is still reversible because whatever damage is done to your gums can still be fixed. But let's say you neglect the dentist for a while and you just ignore your brushing and flossing. And even if you do brush and floss regularly, but if you are avoiding the dentist, there's a chance that this gum disease could progress into something called periodontitis. And the reason is when you go to your dentist or get the teeth cleaned from your hygienist, then they're scraping off something called tartar or calculus. Now this tartar is basically this plaque or this biofilm of bacteria that have hardened and calcified and gotten stuck to your teeth. Now once you get this tartar buildup, it's impossible to remove with your toothbrush and floss. So you have to get it scraped away at your cleaning. And some people are just more prone to getting this tartar buildup. Even if you do brush and floss, you could still get this tartar buildup. Now, if this tartar is not cleaned away, then it's going to cause a lot of inflammation, and this can lead to bleeding gums, and this can also lead to gum recession, and this can also lead to tartar building up below your gums. Now what happens is when this tartar starts building up below your gums, then it keeps causing that inflammation underneath your gums. And then this inflammation can spread to your bones or the supporting structures of your teeth. And then what happens is you get bone loss, where your bones get eaten away. And then you have less and less support that holds your teeth in your jaw. If this gets really severe, then this can lead to your teeth getting more mobile. And this can eventually lead to your teeth shifting and your bite changing. So this is why it's so important to make sure you go to the dentist regularly. Even if you think that nothing is wrong, if you haven't been in a while, make sure you go because you should be going every 6 months at least. Now, number 4 is if you had a tooth extracted recently. Whenever you get a tooth extracted, whether it's because you had an accident and that tooth broke, or because you had a huge cavity and that tooth is no longer fixable, then whenever you get that tooth out, those teeth next to it will try to close in and fill that missing space. Because your teeth like to be in contact with one another. And if they sense that there's no contact next to it, then they're going to try to keep moving until they find that next contact. So that's why I always recommend, if I am extracting a tooth, to make sure there is a replacement. Because if you ignore replacing that tooth, then you risk compromising the teeth next to it. Because the teeth next to it can start to drift in and try to fill that missing space. But also the tooth that opposes where that missing space is, like the tooth that used to hit on that tooth that now got extracted, will start to hyper-erupt and also try to grow into that missing space. Now, this doesn't happen to everybody. Some people don't have this issue where their teeth drift, but some people do. So it's not worth it to take the risk if you are getting a tooth extracted, in my opinion. Now, number 5 is lack of retention after orthodontics. Now, we talked a little bit about this already, but if you get braces or some clear aligners and you don't wear your retainer after, then your teeth are gonna shift back to where they were. They probably won't go all the way back, but they're gonna shift again, and then you're gonna end up with crowding again, and then you're gonna be sad because you spent all that money on the braces or orthodontics or Invisalign or whatever, and now it all went to waste. Number 6 is grinding or clenching your teeth. We call these movements, like if you grind or clench your teeth, parafunctional habits. Another word for grinding your teeth is called bruxism. But whatever you want to call it, if you are spending all night grinding those teeth back and forth or clenching your teeth, then this is going to shift your teeth. Because now you have this excessive force, but you're doing it all night long. And you might end up intruding your teeth, where you're kind of pushing your teeth in a little bit, or you might start to rotate or start crowding your teeth because of this excessive force you're putting every night after every night. So the simplest way to prevent this or fix this is getting a bite guard made. So a bite guard is basically this thicker retainer that is made, and it's only made for one arch, either your top or your bottom arch, and it's basically meant to deflect all those forces when you're grinding your teeth. So now, instead of putting all that pressure with your teeth, your teeth are basically going to glide back and forth, and that bite's going to be evenly distributed, so your teeth shouldn't shift from the grinding anymore. And also the other benefit you get from this is if you have TMJ pain or headaches or something, this can relieve a lot of those symptoms because it's relieving the use of those muscles from you grinding your teeth all night. Now, number 7 is trauma. So if you have trauma to your face or your mouth area, then this can also shift your teeth. So this is really common for hockey fighters or UFC fighters or two brothers that were just growing up fighting with each other. But sometimes if a tooth gets hit, it can hurt, but it'll stay still and it won't break. If that happens, you're lucky because usually there's no other treatment necessary. But sometimes that tooth can break and that is a whole different problem. But sometimes that tooth will just shift and it won't crack or it won't break or anything, but it will be in a different position. Now, if that does happen to you, it's not the end of the world because it can be corrected. And usually all it takes is some sort of ortho or braces or something just to kind of pull that tooth back to where it was supposed to be so that it stays there again. Now, number 8, the last thing on my list is poor dental work. So sometimes you just have an ill-fitting appliance. Like if you get a partial denture made and it just doesn't fit right and it's putting too much pressure on a couple of your teeth, it can cause those teeth to shift over time because it's kind of acting like a clear aligner or a retainer that doesn't fit so well that's kind of shifting your teeth. A good rule of thumb is if you're trying an appliance in your mouth, you shouldn't have to force it in super hard. Like if you haven't worn your retainer for many months and it doesn't really fit and you're trying to shove it in, chances are it's probably not fitting so well and it might be shifting your teeth in a direction you don't want it to. If something isn't fitting correctly in your mouth, then that means it's not doing the necessary function it's trying to do. So if you ever feel like this is happening to you, make sure you go to your dentist to get it checked out and see if it needs to be adjusted. Now I'm going to give you one more bonus, which is more of a myth, but it is your wisdom teeth coming in. So a lot of people come into me and they say that my wisdom teeth are coming in and it's causing my teeth to shift. This is a myth. Your wisdom teeth coming in do not generate enough pressure to cause your other teeth to shift. Instead, there's probably something else that's going on, probably one of the things that I mentioned on this list, that is instead causing your teeth to shift. Hey guys, let's talk about TMJ, or should I say TMJ pain, because everyone has a TMJ. TMJ stands for your temporomandibular joint. It's this jaw joint right here that helps you open and close your mouth. Now, a lot of people, when they have pain in their jaw, they say they have TMJ, but it's really called